Hello, Shippy Shipmates. We're back. We are live now.
All right.
All right, thank you. Cool. All right, I'm trying to find our place. All right, I believe we're back.
I'm
Yep.
still seeing the old one that ended
Oh yeah?
on the booth. Oh, well. Actually, I might be. Um, yeah.
Yeah.
Okay.
All right, is it playing for you?
Now it is on YouTube. So I just sent you the newest one. But that one is
Got it. All right. All right, I think this may be working. There are now 200 people making their way through the booth. Is it working yet?
I'm not seeing it working.
That is interesting because I'm definitely up on.
Yeah, I see you working on YouTube. Oh,
Here, I'm putting up 2 thumbs up so that we can see whether or not the 2 thumbs up
we're up.
comes across.
Okay.
We are
I
up.
see it.
All right, there are 200 people making their way through the.
Okay. Yeah, they're working on my end now for both.
Okay, great. All right. Could you bring me an Excel unit? And Keith, can you hear me? Okay. So I think, Keith, that what I will do as soon as we have a current visitor, although all visitors, there's a lot of so I think, Keith, it seems like there may be people who are joining that are not on the current visitors thing. So I'm going to ask you to just go ahead and sort of demo what each of the different devices are, so that anybody that pops in will have, you know, they'll join a demo in progress. So.
Okay, so well, in which case I have the knee unit. Let me go grab the elbow and a planner.
Okay. All right.
Okay. Give me just one moment.
All right, that sounds good. Yeah, all I need is the XL large unit. So what we have, so we've got, John and Chris, we've got a vibration unit that has a 10-minute timer on it. This is mechanical stimulation. So instead of electrical stimulation, which you put on and it stimulates the nerves a little bit, mechanical stimulation actually stimulates the pain blocking receptor called the Pacinian corpuscle. So what we have is this particular frequency goes into a compression pack. And then this compression pack, we've got different ones for either the knee, for the elbow, for the shoulder. So this unit right here is a 28-inch knee unit. This is the one that's most commonly used for people that have knee pain, people that have waiting for surgery. It's got an ice pack that goes on the back of it. And so the ice pack goes into where the knee is. And this will then, with one touch activation, decrease pain before surgery or while you're waiting for a knee replacement or any kind of elective surgery. So the knee one has a 4-chamber ice pack that freezes solid, so you can combine the electrical stimulation feeling with mechanical stimulation that's more potent, and then ice for inflammation. We've also got e-stim. I don't even know why I'm saying e-stim. I keep waiting because John pops up and then goes away. So, but thank you. That's exactly the unit that I was hoping for right there. All right, Keith, I'm going to put you on to talk. I don't know how accurate the current visitors are, so I'm going to just go ahead and say, go ahead and start talking. I'm going to try to find a light-colored shirt so I can demo my VibraCool against a shirt that people can see it. All right?
Okay.
Rock and roll.
Is anybody on right now?
So right now I don't see anybody, but then we have definitely, but I don't see you either. So I think that we've had like 30 visitors, so I think that there are visitors that you can't necessarily see, or maybe you just see it when they log in, but you don't see the current visitors. So I'd say go ahead and start talking about our stuff.
Okay, and just you're gonna do it, record on this and then use that?
It's live, it's going.
Well, fantastic. All right.
I'll be right back.
All right. So, hi everyone. I'm Keith Cronin. I'm a physical therapist, and there's some great options that you can use VibraCool for, even beyond what you just currently see in the package. So, one of the great things that you can use this for is a common thing is knee pain. And so, with the strap, comes right around, and it can easily go. It's extended, so it can fit around the thigh muscle, but it can get around the knee. This is great for using with patellofemoral issues, or if you have had a total knee replacement. But even from a knee perspective, it goes on super easy. You can just put it right across the front, Wrap it all the way around. And then all you have to do is just hit a button and we're good to go. Now, this is one of the regular uses for this. Some of the other things that you can do with the VibraCool is you can actually take out the unit itself and you can use it for other things. So, for instance, we have the band right here that you can use to get around for neck or for back pain, or you could choose to take the unit out. And what you can do is you can put it onto, you have just a common back brace. So I'm one of those individuals who uses it because I have a herniated disc in the back, so it doesn't not just a present but also a client. So what you can do is you can actually take the unit and you can take the press the button. The cool part is you can actually go exactly where you need it to be, and it stays perfectly in place the entire time. And Amy's back.
That's cool.
She's shown the way that you can use this with just a standard everyday back brace. And now you have something for your knee as well as for your back, because I'm sure you have one around the house somewhere. And again, you can use it, again, strapped across the neck, common for rotator cuff pain, anyone who has chronic tendonitis in the elbow, very, very just daily things that you have. It provides a lot of relief and gives you a benefit that lasts for hours. And it's just at a little touch of a button.
Well, so, I've got to ask you now, Keith, I have been having pain in my shoulder. So the shoulder pain has not changed from when I ripped it. And I actually think if you look at me, I'm cattywampus. I'm like a couple inches taller on this side and this side. There's definitely, it's something not right. So, so how would you use VibraCool to deal with what I think I must have, it hurts right there. So wherever I ripped off, like right there, that is point tender. So would you put the VibraCool directly on it? How would you recommend taking care of that kind of pain?
So I use it for two things. I first address the pain because it hurts. Okay, and so that's going directly over the front part of the shoulder with the unit. And you can use it with the elbow unit. You can strap around and tighten it up, or you can go ahead and use the one with the strap on it, and you can put it across and you can get that compression. But inevitably, a lot of the times the reason it hurts here is because your shoulder's dipped and forward, and that's why you're trying to kind of lift it up a little bit. That will give you that pain back here. So inevitably, I would be taking this and be putting it back here at the top part of the shoulder blade, because that's the part that is inevitably very tired and weak, and it's used from guarding the entire time.
Yeah, this part actually, this part, this makes it feel better.
Good.
I've been swimming. Should I, it's always do you use it when it hurts or do you not use it when it hurts? What do you think?
That's the
do you push through the pain or do you baby it?
What you do is you first prepare your body for movement. So I would use this ahead of swimming to get everything nice and oscillated and moving. That's what the mechanical stimulus is for.
Yeah.
And then inevitably what you do is pain's a little bit of your guide. You have a chronic issue. And so the challenge with chronic issues, you just can't stop. It'd be one thing if that day before you got really hit hard in the shoulder, then I'd recommend, you just need to baby it a bit and let it heal. But this is something that's been going on for a while. So inevitably, I'd recommend that you kind of taper down your activity, maybe choose a stroke for swimming that is not as irritating on the shoulder. And then inevitably kind of gauge that with a combination of stretching, using this before, and I would even still use it after, because you got to calm it down and do the best you can to work those scapular muscles to try to get it back into a better position. Because as it's sitting down, you'll lift it up like this, and it just kind of, you're always going to get that pinching sensation right there in the front.
Yeah, and that's exactly what it is. It's a pinching sensation right there. And the thing is, when I'm swimming, it doesn't bother me. Like once I've warmed up, it doesn't bother me. But then, the next day or going to sleep, trying to lift the arm up, this is the move that hurts. Is rotating backwards that way. That's what hurts, and it hurts right there. Yeah. But so you're saying that I like the idea of using the vibration by itself to warm it up for before going out.
Because that's inevitably why when you start moving, it starts to feel better, is because you started to loosen it up, you started to get into better position, and it starts, that's what helps. And so if you can do that ahead of time before you make that, say, first movement, where it's kind of grinding its way through, which will set off a little bit more of an inflammation process. If you can warm that up better, you're less likely to have the issues, that after effect where the next day you're like, oh gosh, I can't lift this thing up, because most of the irritation probably occurred right at the beginning.
Oh, that's interesting. So, so I can avoid that. And then, would you use heat or ice after I get done with swimming, or if it's warmed up, then I don't really need to do anything to it? What would you recommend?
At the beginning, definitely, if it's chronic issues, heat's probably going to be the better bet, because you want to get the tissue up and moving. But afterwards, it's going to be a little bit more of a viewer's choice. I would recommend cold, just because you want things to calm down. But when anything that is a chronic irritation, you'd have to realize that it's those nerve endings are just responding the way that they are, and whatever gives you relief is probably the best bet. Again, I still would promote cold, because that's probably going to give you the better pain relief, but I'm not going to kick heat out if you have relief from that, because the bigger issue is mechanically getting yourself back into position. And it's hard to do in pain, because if you hurt, you're going to twist to turn to wherever it doesn't hurt, and you're going to stay there. Unfortunately, it's going to be a position that may cause more problems long term.
So when you have injured, say you've got a chronic injury, you lift something and you re-injure it, is there a general guideline for how many days you should rest it before you can start using it again?
Yeah, pain and function is going to be the guide, but it'll be somewhere between 48 and 72 hours.
Okay.
Because at that point, the inflammation process should be up and going, and you'll be able to see where you currently are. And so if there was something very acute, then yes, I would calm it down. It doesn't mean you stop movement altogether, but I would remove from any irritating or large scale activity. So for instance, swimming would be something that would be far more strenuous, that you'd probably want to avoid. But after that period of time, it's that you have to go check to see what needs to be done. And you can't baby it the whole time, because inevitably it doesn't get stronger. Mechanically, you don't get back in position, and you will just fall into patterns of movement, which are going to cause you more problems long term.
Interesting. Are there particular exercises that are good to strengthen what is probably weak right now?
So if your shoulder is falling down and in, and it feels better kind of more up and back, inevitably any rowing exercise, rotator cuff ones where we do scapular exercises where we're pulling them together. The great part is, even if we're using this particular one, you could literally just use the band and then rotate the shoulders back and then pull them. So you could take your unit, use it on your shoulder, take the band off, and now you have a strengthening exercise where you can pull.
Okay, I feel my band.
Yep.
Now so I tie my band together.
Yep. So you can tie it together, or you can undo it. So it's just so you don't have to leave it in a tied position. I just did that for the convenience.
Okay.
I'll pull it out right now.
All right. And
you can take, this is one of the easiest ones I like to show people, just for shoulder exercise. So you take the band, and then what you do is you can wrap it around the thumb. And so it can come right here. And the reason this is important, it kind of leaves your hand nice and free, so you're not grabbing it. Okay. And so you can just wrap it around your hand so it stays. You can do it however you want, but the whole point is so you don't have to hold the band tight. So you leave your fingers, they call it jazz fingers. Yay.
Oh, I see. Okay.
Right, so the reason why we do that is because we're going to create that the opposite of this. So the opposite of that is clenched hands, wrists in, flexed, rotated forward. So instead, we're going to extend the wrists, extend the fingers, pull the shoulders back, and then rotate out like that. And then pulling the band. And what this does, you see my little fingers are far apart.
I see your just, okay.
What this does is this encourages the opposite, everything that is the opposite of this. So it's not just ramping up the shoulders to move that way, you're ramping up the brain to go in that direction.
Oh, interesting. Okay.
Bruder's exercise. And it's a very simple one. And the great part is because if you already have the VibraCool, you already have the band.
Yeah. Yeah.
Doing this, again, and you hold, you hold this for 4, 5, even 10 seconds because you're trying to encourage that to come back. That's what you're trying to do with this. and you're just providing that resistance, and that pulls the head back, that pulls the shoulders back, and it actually drops them into the correct position.
Wow.
All using the same band that you have in the VibraCool.
Cool. And how many times would you need to do it?
So I generally recommend when you start, you're doing 5 to 10 reps, and you're holding it for 5 to 10 seconds each, because this is not just a strengthening exercise. It is a neural stimulation activity to get this part of your head working. And you do that 2 to 3 times a day. And then inevitably over the course of time, you start adding resistance to try to build more strength and stamina. But within the first 2 weeks, inevitably any changes you have are neuromuscular. So it's just connecting this part of your neck, that part of your shoulder, pulling it back with the extensor part of your brain, which is the opposite of being on an iPhone.
Wow. Wow.
And it doesn't take much. And they usually find with just a small amount of activity, you will encourage that pattern of movement and inevitably put the shoulder in a little bit better position. And then at that point, you'll find out with that, does it get better, worse, or no different?
Wow. So let's talk a little bit about cell phone neck. So I don't know about you, but I have actually started having my fingers got shaped so that it'll hold my iPhone. So
yeah.
I've got the
Yeah, you got it held underneath. Yeah.
Right. Isn't that terrible? So, but for neck pain, what do you recommend? How would you use VibraCool or bands or both for neck pain from the bad posture of checking out your phone all the time?
Yeah. So one of the things you can do, and it's a little ridiculous, but this is one of those things where I try to recommend, how can you change a habit? We tend to, just like you put your finger underneath, you get that little change right there, right? Just that little bony change where it's like sits in the nook.
Yeah.
You can, and this is hard for individuals, we like to look at our phone down here. Okay? It's just it drops because it's like we're bringing ourselves closer to the phone. Inevitably, if you want to, you could turn your phone into a strengthening exercise, just doing this when you do some text, put it up. Okay. And the reason is because what you're going to do is you're going to encourage this motion. And so one of the areas where we don't see individuals with shoulder and neck problems are volleyball players. And the reason is they stand like this at the net, and they strengthen everything that's coming up. So what you can do is you can take your phone and you can turn that into your own exercise, where you just a few times a day, even just putting it up like this and trying to keep your back in the correct position, you will encourage that activation, because what's happening in your brain, you can do it with the band too. What's happening in your brain is all day you're cycling this motion. Instead, you can cycle.
You take the vitamin this up.
Yep,
Yeah.
put it straight up.
Yeah.
And it's a little goofy, but it's just mechanics. It's the way you're still texting and talking.
So your arms get tired and they gradually go down.
And they come down, and then you know where your stamina is. But it also shows you, if anyone does this, see how long you last. And I bet no one lasts much more than 20 seconds.
Except for the hairdressers. Hairdressers, man, hairdressers have the strength of life to put themselves up for.
So they get the thumb injury from the scissors. They don't get the shoulder ones because you can't slump over somebody and cut. You have to actually be upright, believe it or not. So house painters, same deal up here. They're reaching up. I just don't see the same problems we do from the iPhone beating you up all day long.
Yeah. Yeah. Oh, that's very interesting. That's cool. So if you have a pain in a particular place, like where do you see the neck hypertrophying? Where do you see people wanting to put VibraCool if they've got neck pain?
Right there.
Yeah.
It's always right there. It's at the corner. So it's where the levator scapula comes off of your neck and comes into your shoulder blade.
Mm-hmm.
That spot where it puts it, when you do this and round shoulders, you put it in a weakened position, so it has to work harder to do the same job. And so you kind of beat it up all day long.
So I'm thinking that the best place for this, or the best one to use, is going to be the Easy Fit, because
You
Because
can get that thing up and around, and then right on the spot.
exactly on the spot. Yeah.
And that's a spasm. So that's a tighten, weaken tissue. So we always think something spasms because it's tight and too active. It does it because it gets chronically weak. And so it just locks in place. So what we want to do is break up that abnormal pattern. The muscle should stretch and move and relax. But what happens is it becomes tonic and doesn't move anywhere. Then it gets super weak throughout the range. And that's why, as an example, put your phone up overhead and you'll find out really quick what doesn't have much stamina.
Well, so that's why low back pains tend to spasm, is because they're weak. It's not because they're
either two things. They're overcompensating, so they're trying to activate too many things to do a very small job. Or the other part is it's because of chronic acute pain or acute irritation causes more muscle excitation. When you have it chronically, it can tend to depress things, and if you don't have any activity, discs start going different directions. So you have to be able to clamp down. So your body's response to it is hold in place. It's like, if I lock here, then I won't irritate the little nerve endings that come out. But inevitably, you rob Peter to pay Paul, and eventually it all starts to fall apart. Which is why then, if you can use a VibraCool, even just with a back brace, and get it in there, you can first calm down the pain for those posterior cutaneous nerve fibers that come out the back, and those are the ones that are achy in the back. And then inevitably that tightness that you get to that quadratus or those deep back muscles, if you can break up the spasm, then you need to do normal movement. This whole idea that our backs need to be stiff and not move all day long, it does not work, because the back is intended to move. We just need to make sure that it does it in a pain-free and normal range of motion. And if you're hurting, you're just gonna, I don't want to move. I'm scared. That kind of thing. We want to definitely avoid that.
So, do you find that there are any benefits from having like sitting on a ball? Like I'm right now sitting on one of those roller balls, with the concept being that it's going to be a little bit more mobility going back and forth. Is there any, is that right? Is that a good way to decrease low back pain, or are these balls actually?
You do it for shorter periods though. So the idea that you sit on a bouncy ball for 8 hours, you're going to create a problem in the different direction. So I do recommend everybody that,
because I get up at the end of the night and I'm like, my butt's killing me.
Yeah. So nice part about being on a bouncy ball is you're going to be less likely to get that sciatic issue, because you're not going to have pressure points along the SI joint, which is really good. Also, because you tend to be dynamic and moving, you're getting a bit more vascularization to the spine, because the spine does not have good blood flow, but when you move, it does.
Yeah.
So it's sort of like the catch-22. If you don't move, it doesn't get good flow, and then if you move, it hurts. But you need that to
You gotta,
to nourish your spine. So I say 20, 30 minutes at a time. Once you get better at it, an hour or so, hour and a half at tops. But after that, I don't know. It's sort of like the concept of people who drink, I'm going to drink, 12 gallons of water a day because that'll flush me out better. It's like, well, you're probably good at a gallon or two. You're good. But after that, you're just hosing your system. So
right. There's a point at which,
diminish returns.
So many of these you can do, and then you're in your shoulders are hypertrophied and back, and you look like Ralph.
Yeah, you will eventually get the other problem where you'll get a thoracic issue if you pull back too much. Your little spinous processes and the facets will sit on each other too much, and you'll get a different problem back there. We get sway back, but kind of sit back like that, and you'll get a pressure point. You can usually point it with a finger, go, and it's there. And they go,
yeah.
They go, oh, VibraCool goes there.
That's really good. Yeah, I like your idea about the brace. I think that the VibraCool in a brace that's already there makes so much sense for the concept of strengthening the muscle, and right at the point where you need to loosen it to make it work a little bit better. That's impressive.
Do have to, and it's important. Pain is very important. I mean, and you go to, they're like, oh, we got to move, and we'll get to pain. No, pain is very important. If you hurt, you're not, and that's the great part about this, is to get them immediately out of pain so you can do the other things that you need to do to get better. The VibraCool itself will not fix all the issues, but what it's going to do is going to put you in a position where you can fix your issues, where otherwise it'd be just too irritating. And then your answer is like, well, I'm just going to do nothing. And we don't want that.
So I have a question for you.
Mm-hmm.
I have my answer. When people ask me if I'm just going to get one VibraCool and I hurt lots of places, which one should I use?
Mm-hmm.
What is your answer to that question?
Honestly, I'd say get the knee unit, because
Yeah.
the strap's a bit longer. And then inevitably, if you need something for like a back, you probably, if you're a back person, you have a brace somewhere in your house. I promise you will. Okay. And then that's something you can just slide down. So that's why I like the knee. It's extended so it can get around larger body parts, but because it's extended, it's able to reach a little bit better.
Mm-hmm.
But to me personally, if you're going to get one, I would recommend getting two. And just because in lots of places, if you hurt here and here, you're going to take it and then work at that area, and then you're going to move it over here and then work that area. It just seems to be more conscious to see it both at the same time.
So I will admit, when I travel, I tend to travel with an easy fit.
Mm-hmm.
And I think, first of all, I've got a fairly small knee area, so I can use it with the knee. But I think the reason is because what I have found is if I have plantar fasciitis, or if I have to be on my feet, that the compression
Mm-hmm.
of this, so putting this on the plantar area with the compression is astounding.
That's fantastic.
I had this weird thing happen. So I used this for about 40 minutes after I was at JP Morgan this year. I was walking around San Francisco. I had bad pair of shoes, and I could feel the plantar fasciitis starting. I used it for about 45 minutes, and my foot literally, I don't know, it's like synesthesia. It felt like a spring. I mean, it felt like I could feel it having a spring sound, and the plantar fasciitis completely went away. I've never shared this with anyone. Do you have any idea what might have happened? What's going on there?
Yeah, so inevitably what you're getting is as you start to irritate and chronically irritate the tissues, they start to shut down. Mm-hmm. And as they start to shut down, they start to get tighter. And then your foot no longer becomes a malleable, we'll call it does not grip to the environment very well. So it's a shock absorber. The foot is a shock absorber. A quarter of all your bones are in your feet. And there's a reason. It's because it's designed to shoot different forces through the first part of your arch. Then it's supposed to rotate down, and it's going to spread force that way. And then you're supposed to get to the next joint up, and that's going to spread force that way. If it turns into a block, inevitably that plantar fascia, that actual tissue, is no longer having muscular support, and it is no longer shock absorbing, which means it's just getting hammered. Mm-hmm. It's also not getting good blood flow. The tissues are tightening up, so you now are walking on cinder blocks. The reason why you felt so good is because you took this and you mechanically stimulated and oscillated the area, and you broke up the tension, and now the foot worked again. So now the flexor hallucis longus is working. It's pushing off. It's lifting the arch. The intrinsics are holding it in place and absorbing force. The plantar fascia is now able to take the load it's supposed to take, and then it's transmitting it up the chain. So anytime I see individuals who have that, and then this is very responsive to it, is because you just need to break up that tightness, and that compression, you just squeezed it tight into the area to get it deep in there just to work phenomenally.
Why would it feel like a spring though? I mean, it almost jangled.
Like it comes to life, right? Well,
it was wild. Yeah.
Yeah. So think of course over the course of the day, your foot doesn't just turn off. It doesn't go, well, it's off. It slowly starts to go down, and then you accommodate to it. You change the way you walk. You maybe pivot a little bit to the left, lean a little bit forward, because you're still going to go from A to B. So and then when all of a sudden it's now off, you don't even know it. It's just a brick. Yeah. You then took this, got that foot activated again. Now all of a sudden you take those first steps, and it's like it's just like your calf muscles, your intrinsics, that big toe muscle is pushing off, and you're like on a skateboard. You're like flying forward.
Yeah, I mean, it definitely the pain going away was amazing. It was also interesting that it was 45 minutes. Like I I left it on longer than we usually tell people to do it, and it was great. So it was
warmed up the tissue. It's going to take a little bit longer, inevitably, because you're not just addressing a neuro function there of pain. You were getting in there and oscillating that tissue. And I bet you that plantar fascia felt a lot better because now it's being able to be used correctly, but then the stuff around it is activating so it doesn't take the whole force of it. And then you get one of two things. You get it right in the middle, or you get it right near the back of your on your calcaneus, on that heel, where it goes into it. That's the spot that gets people a lot, is because
right. Yeah, definitely.
Transmission of energy spot to the next segment.
Right. Yeah, the plantar spot.
Right there,
yeah, right there. That's the move.
That one's a pain to treat. So if you can do it on your own, that's phenomenal. You have to go see somebody like me. Oh, I got to do a lot of work to that foot.
Yeah, it was amazing because I've had plantar fasciitis so many times, and to have it just be like erased and to have that kind of magical jangling feeling was amazing. You know, one thing I have wondered about VibraCool. So first of all, anytime you're putting energy into a system, it seems like you're going to have that energy is going to go someplace, like go into potential from mechanical energy. And so you have a friend there?
Yeah, my dog. I have to go boot her upstairs real quick. Go on.
All right. So one thing about VibraCool is I have wondered whether or not the mechanical energy that is being put into the different muscles. You know, when a muscle discharges, you have it, you know, the actin and myosin cross over and it pulls to become activated, and then you lose some of the power. So I've wondered whether or not the mechanical energy of the stimulation, the mechanical stim, is actually kind of is making it uncock so that it's ready to cock again, so that it's preloading to strengthen the muscles. Like, is that why mechanical stimulation causes people to be able to jump higher? Is that why their strength of kick is greater? What's the mechanism that is making strength better after you apply mechanical stim to it?
So part of the actin myosin, yes, if they're always, the cross bridge is essentially locked in the wrong area and you're always in a weakened position, then inevitably, if you're able to get full range and be able to activate the entire thing, you're going to already have better strength. Another part is just the neuromuscular stimulation part. So chronic pain shuts down muscle activity. It just, over the course of time, you're either going to spasm, you're going to hold in place, or it's going to gradually weaken. We see this very commonly with ACL surgeries.
Really?
So the quad, because of swelling, just shuts the thing off. Okay. And because you've gone in there and done so much trauma to the area, we have to like jumpstart the thing back to life. And with this, you're doing, you know, the direct mechanism of what other things do more secondarily. So you're using this right over the muscle. You don't have to guess where the electrical point is. You just go straight to the motor point, and it goes deep into it, and then you are hijacking the system, which needs to be hijacked because it's not working well.
Yeah.
And so we see individuals who do best with this who aren't having good muscular function. Now it gets to the end where if someone's perfectly functioning great, this thing may warm you up, but it's not going to fire you over the almost like a competitive advantage. But if it isn't working correctly, like sort of like the brain to muscle is not happening right. Mm-hmm. You need to do something to re-energize that system. And then once it does, it worked before, it will work again.
I might push back a little bit though, because one of the things was interesting, talking to the guys who do Theragun. So one of the things that they found was that when they applied the Theragun to the muscles, that the athletes actually got, you know, the skiers got a better time pushing off. And at the time I was like, you know what? I bet I know what's going on. What's happening is that they are taking those actin myosin links, which are already spasmed, you know, they've already given up their stuff and they need ATP to be able to recock to go again. I bet the mechanical energy is taking these guys and then just resetting them. And so if Theragun's doing that on one really small place, I bet the intensity of the VibraCool stimulation is also doing that. I think it makes sense that we're giving a little bit of extra strength, not just to damaged areas, but to areas that have already been used somewhat, but actually have more potential if you got all of the actin-myosin fibers on.
There we go. So that's a great way to put it. Inevitably, we're always limited by our own ability to activate everything that we have in our own system. And so, so the reference I'm making is to the ones who are the most in tune, top elite, who are already, generally speaking, like at the peak of their game. If you still have a reservoir left of stuff you can activate, any sort of mechanical energy that you can put into the area is going to bring on more stuff. Now, the question still will be, do you have enough strength, stamina to be able to manage that muscle and to be able to use it appropriately? We see this commonly when I treat patients with back pain. They get them out of back pain, and the first thing is like, I'm going back to golfing. I'm like, well, hold on. We have your mechanics working now. You can rotate enough, but you don't have enough strength and stamina to control that rotation. So you're going to get up there and, heave-ho that right at that ball, but then you're going to, I'm going to twist another part of your back. So it comes with that sort of double-edged sword. You can turn the thing on. You just got to make sure that you use it appropriately. And if you do, it's a phenomenal asset that you can have that just sits in your bag. I mean, that's like, it's awesome.
One thing that I think is interesting is using mechanical stimulation for delayed onset muscle soreness. The studies all use 5 minutes. I wonder what would happen if you used 10 minutes to give those muscles a chance to be separated to warm up, but then had extra time. It would be interesting to know when the diminishing return comes. When you're trying to warm up the muscles to decrease that delayed onset muscle soreness that comes from overuse. I wonder where the maximum benefit comes from would be.
I don't know what the max is, but I don't think it's at 5 minutes.
Really?
No, only just because, let's just use your example, just even with your foot, you felt super springy, everything on there for 45 minutes.
Yeah.
It's a question of at what point do you get enough excitation that has hit all of the motor points and it's now ready to rock. That, if everything's been done at 5 and it's already shown, significant improvements, I would say keep going up. I mean, you can say, what's your risk reward?
Yeah.
So you get more excitable muscles. I mean, you get more blood flow.
The nice thing is now that I've got an actual, damaged shoulder piece, so now I can try it for a couple times because I am swimming every 48 hours. And so I'll try it for 10 minutes tomorrow, and then I'll try it for 5 minutes the next time. And
that's great. That's how I figure out these things with my back. I would take them, and for me personally, I would get relief somewhere between 7 and 10 minutes with putting this in, and that released the spasm, and then I'd be able to move about my day. There's no one who gets into the world of physical therapy who hasn't used themselves as a human guinea pig for their entire career. And that's how we figure stuff out, though. It doesn't mean what you have will work with everybody, but you got to start somewhere. You have to.
Do you think that most people who have had, who go into physical therapy have had some kind of chronic pain?
Absolutely. It's because you get obsessed with figuring out what's wrong with me.
Yeah.
And in doing so, you learn a lot along the way.
Yeah.
And then you figure out, well, I'm not the most special sunflower in the world. I'm not the 0.01% here. What I probably have is common to other individuals. And in learning so, you can identify it better with other individuals and provide very, 90+% of it is very basic advice if it's just adhered to. Every once in a while, you get some odd stuff, but it's obsession that leads to progression. That's what it leads to.
All right. So if I were going to make you the perfect device for your low back, how would you change the VibraCool we have now to be your dream low back pain device? I
would just have it so it could vibrate in different areas. I'd have it so it can compress. So if you want that compression, that's really nice. And that's why when you put a back brace on, you get large uniform compression. And then you just stick the unit in there, and then it's encapsulated on both sides, so it just stays in place.
So you don't mean that you would make it so it was compressing the back itself. You mean that you would make it so that the VibraCool unit was able to be pressed against the lower back?
Yeah, because that way, so we're with our mechanical energy conversation here. The more contact it has in there, the more it can get in. And the back has some deeper structures that it's not just superficial. We want to get a little, we're going to have to get a little bit deep. Quadratus lumborum is down under like what, 4 layers of muscle and tissue. And that's the culprit for a lot of back spasms. So if you can get down to that guy, once that releases, everything else just moves fantastic.
Interesting. Yeah. Yeah, you know, we're working on the duotherm right now, so we've got a much wider area that has the vibration distributed over it with compression, where that you can push in. But I think that the thing that's most important about it is that it has different intensities and different frequencies that kind of go back and forth, and that's going to be really interesting to see how much of the repair of the low back comes from a single uniform frequency that's pressed in, and how much comes from multiple ones.
Modulating is great because your body does tend to get used to certain frequencies, and the spine is just an extension of the brain. You gotta, you know, if you look at anything, neck, spine, that whole cord is just the tail of the brain, and it takes a little bit more to tease that thing around. That's why some people like heat, some people like cold, some people like laying on their left side, some people like laying on the right side. Mechanically, it's not always a uniform answer for chronic back pain, and that's why it's so hard to treat.
Yeah. Although I will say one thing that's been really interesting. So, you know, we've got the Buzzy device that works for needle pain. So I have tried doing variable oscillations to see whether or not having different frequencies, you know, does the brain accommodate, do the nerves accommodate? And what we find specifically for that kind of pain is that it doesn't. It really, and I think it's because, you know, we've got our one specific frequency that is the one that decreases pain the most. And so if that's the nerve we're trying to trigger, you don't really want to or need to deviate. You know, you just keep pushing. You know, it's like you're pushing a button. You just keep pushing that button.
Hold on to it, right?
Yeah, exactly. It's and that's the one that works. But I tend to think you're right. I tend to think that there's so much involved with low back pain that it's going to be a multiple frequencies approach. I think we're going to get different results from that.
I think one of the other parts is, and it's beyond the science part, is the control aspect. Is individuals who have chronic pain want to find ways to be able to control it, and being able to have some sort of modulation for it. Inevitably, right now they feel there's nothing I can do. Right, I am helpless, and that makes individuals hurt more. Makes them, you know, chronic. You look at the rates of chronic back pain and depression. I mean, they're right in tune with one another.
Absolutely.
And we can do things that give people, like, you're going to have this. Here's the things that you can do to make yourself. You can change this. Here's the options that you have. It gets them at least a little bit more involved. But just to your point, the science. You know the science. If I hit this, I'm going to get from here to here. The question is what do we have to do to get all the other blocks out of the way, which are sometimes beyond science? You know, am I happy in my current life? Do I have control of what I'm doing? Do I feel like this is going to get better? Those types of things.
Right. And I think that is the absolute truth behind using acupressure, using the whole, you know, the what works for pain, the whole what works for pain melange, is that the more things you can try that you haven't tried yet, and the more variation, then the less anxious and the less you feel at the mercy of pain, as opposed to that you have power over pain. So it's definitely
power over pain. That's true.
Yeah. You know, a long time ago, you were talking about chiropractors, and I don't know if it was some kind of activation. There was something you were thinking about using mechanical stim to increase the efficacy of what they were doing. Do you remember what that was? What was it?
So part of it was putting it on both feet.
Right. Why? What's the deal with that?
So inevitably, let's just look at ourselves as a big circuit. Okay, we have nose to toes, right? You have a lot of stimulators that are in your feet that can affect everything from, just as you pointed out, I felt springy and I'm alive,
Mhm.
And the whole idea was if we could do something to stimulate individuals who have chronic back pain that results in radiculopathy, so pain going down the leg, oftentimes going into the feet. It would be big toe in between there on the bottom of the foot. If we could put a stimulation the opposite direction, that would be able to counter that whole gait theory. If we could shut that thing down and so it's not as radiating, that they have a more effective overall treatment. So oftentimes when doing things like adjustments, or they're doing things, soft tissue work, it should be one more stimulation to try to get rid of that pain. And as someone who's had that pain many times in my life, I can tell you this: when it hurts down your leg, but it's not your leg, that's the problem. It is working on your brain to understand that. And if you can get the pain, it's weird to say, if you can get the back pain back to the back, it is far better to manage it than if they say I have no back pain, but both my legs are burning and my feet hurt. That means those nerves are getting crushed in the spine, and it's progressed a fair bit. So it's just an idea of how can you stimulate it to calm down some of that sensation to inevitably do the work that needs to be done to stabilize the spine.
So I think it's time to go back to your chiro guy who owes us a $500 podcast, and you should go on. You should talk about that.
I think it's just, and I'm happy to reach out to him. It's a theory. This is not a full-blown science theory, but it's something that I personally use, knowing that if I stimulate the bottom of that foot, it didn't get rid of it, but it made it more manageable. I can tell you that.
Yeah. Well, I think it's at least one item that'd be worth talking about on the chiro podcast. And I have also long thought that having, once we're back and doing trade shows in person again, the absolute, I would pay an enormous amount of money if I didn't actually make them myself, is a barking dogs kit. So to have two of the Easy Fits, because those can be cranked into a really intense pressure on the feet, like that 45-minute, jangling energy that I got in my feet. But for the chiropractors, I think that having two of the VibraCool Easy Fits would be a really interesting way to, quickly put it on and test and see how that works for their patients.
Because I would do it with manual pressure, and we do it with tools and stuff, and then they'd all of a sudden feel like, oh, my back feels better.
Well, and what we could do is, we can have our VibraCool Pro and have something that can be cleaned. So this can go on the foot for the energy for the.
I think it's perfect.
Yeah. Oh yeah, this is fantastic. We're coming out with all sorts of good ideas.
There's a lot of uses. That's the point. It's one thing that is a Swiss Army knife.
Yeah. I am. What is one of the most difficult places to treat, like physically on the body, when you've got, is it piriformis? Is it someplace specifically in the back, like on the side? If you had one place where when people come in and they're like, oh, I hurt right here, you're like, oh man, this is going to be, buckle up. It's going to take a while.
Yeah, buckle. It's tennis elbow.
Really?
Yeah. There's a reason why there's 14 to 16 common treatments for a tennis elbow.
Because none of them.
They don't know which one works.
Yeah.
And inevitably, because it involves grip, it's hard to stop. Like I can brace someone's foot. I can brace a knee. I can do things to take the load out of a lot of parts of the body. I can move your back, and I can take load off this hip like a piriformis. I can shift you. I can't shift your elbow. There's nothing I can do except say use your other hand all the time, or don't pick things up. I can't transmit the force around here. So inevitably, having something like this, what it does is it's able to oscillate the area, break up the tight tissue that's in there, and in conjunction with other things is able to restore normal movement. Because when I say buckle up, I always say, give me 2 weeks. And if at 2 weeks you got pains down 50% and you got half of your strength back, I have to be the mean guy who says, okay, I need 12 more. I'm
Wow.
like, what? They go, that doesn't make sense. I go, yes, because I finally got the nerves working again, but the tissue damage is there, and it's going to take 10 to 12 weeks in a grown adult to flip over the tissue, even if we do everything right. And that's why with knees and everything, people oftentimes will grasp, oh, it's big, it's walking. The elbow is what bothers them, is because this shouldn't hurt so much.
Well, the other thing is their livelihoods depend on it.
Yeah,
So
there you
when
go.
we were looking at the numbers when we were first ordering VibraCool, we're like, okay, so we've got this many people who need the knee, and there's only this many people who've got elbow. So we're going to order 1,000 of these and 500 of these, and we sold out of the elbow. And I think the thing is that the elbow may not be as common, but your activities of daily living are actually a lot more dependent on your dominant arm rather than on your leg.
No, that's why I always said tennis elbow is the biggest spot. The other one is patellofemoral syndrome. It's the chronic knee pain that you don't know why. And it's usually because of subtle movement of the kneecap or because of weakness in the quad, which is usually the culprit, pinching of soft tissue. And it's hard to unwind it. Is it your hip? Is it your foot? Is it your back? You just have to. But yeah, tennis elbow is the one that, like, you know what it is. But you're like, oh, this is going to be a pain.
Now, with patellofemoral syndrome, is there one spot that you can point at and say, all right, here? In fact, I'm gonna.
Yeah.
We've sort of done this, but let's see, get in. All right, I wore special pants so I could show, so they come up here. All right, so patellofemoral syndrome. Where on the knee is it? Is it?
It's going to be. It could be anywhere around it, so it can be like a circle around the kneecap. But the most common spot is going to be those little gutters that are on the right and left side of the knee, right in there. So right here.
Is this like meniscus side or up here a little bit?
It's going to be more towards the front. So it'd be right in there. And they'll usually say it's a pinching sensation, and it will sometimes move around. So it'll be a little bit on the right, then it'll flip to the left. But it will be mechanically because the kneecap is grabbing a spot that just hurts. Meniscus pain goes straight across the joint.
Right. All right. What about right there then? What's the this little area up here?
You're going to get what we call IT band snapping syndrome. So that's where the IT band snaps across and it gets a little wear and rub. And that's a common spot. But if for chronic knee pain, then I'll be able to.
Yeah.
There's a knee. They usually sit in these little gutters right in here.
Right. That's patellofemoral syndrome.
Yeah. Here's patellar tendonitis, sits right in the front, or patella, because of the ligament. So, technically it's not tendonitis, but it's on either side of this. And then they'll complain of pain that comes up into here. If you're getting straight across joint pain, that's your meniscus. That one's usually pretty easy to pop out. If you're getting that sort of pinching on the outside, across here, that could be your IT band snapping across.
And what do you do for the IT band snapping across?
Inevitably strengthen the butt and work out the soft tissue because it's spasming.
Get out, strengthening the butt?
Yep.
No way. So what kind of exercises for that?
So any sort of band hip exercises that isolates the rotators, the things that rotate your hip out, external rotators.
So let's get our
squat in the correct position.
Let's get our die. Show me the exercise.
Yeah. So you could do a squat and wrap the band around your knees. So tight, and then rotate out and push, and then do your squats up and down because that'll activate the glutes a lot better.
Wow.
The glute issue. So it's a booty issue. Some would call it gluteal amnesia is what it's called.
Gluteal amnesia. So I had never thought that IT band would be a booty issue.
Yeah, it's a booty issue.
All right. So if I've got my special ball here, then I put the band on and then
squat up and down.
Wow. All right. Well,
if you do it correctly and you rotate out and you feel it, you'll feel that right in the butt, and that's inevitably the spot that you need to strengthen. But it's sort of a catch. There's a little bit of a catch here, and the catch is just this: you can't do too much because inevitably you'll cause spasm and irritation and drive it down again. So piriformis and IT band and your external rotators, your hip, they're all kind of locked together. And if some people's piriformises go correctly and others go between the muscle, and then they get squished down in your sciatic nerve. Just a little unfortunate design flaw.
So how would you use the VibraCool for piriformis pain?
So for piriformis pain, I'd put it either directly right over the spot where it actually hurts, but inevitably where you're going to have the problems is going to be on your hip on the side, right there.
That's
so what I would do is I would probably focus on those two spots because they're more superficial to address the pain that's actually there, to create the viscosity between the tissue and the bones, and then strengthen the other part. Because if you stuck it over there, you'll get some relief, but you have to go through so many layers of muscle and tissue where these other two spots are really superficial. So I would address the symptoms, absolutely, but then you got to do the strengthening, which is going to be core stabilization in the back, and then a lot of booty exercises.
Wow.
That's your best bet.
Yeah. That is impressive. Well, this has really been fascinating and useful, and I think that the best part about having you on is that I get to go through all of my different body issues, and get the free consult here for this. Do you have any questions for me about either nerves, pain, any aspects of what we do that is hard to explain, or that you'd like more in-depth explanation?
Yeah, so I'd say the biggest question I have in my head is a lot to do with that pain mechanism. So, inevitably what's obviously setting it off is a multitude of things, but being able to control it is really critical. And even in my world, we have lots of physical therapists and stuff. We know a lot about pain, but we don't generally get it down to the sciencey level. It's just because it's just not in our nature. We learn all the aspects of it, but then at that point it's like, well, we're not researching pain, we're researching movement. And then pain is part of the process. So I would probably ask, what have you seen, obviously in creating Buzzy, and then, then transmitting that over here VibraCool with obviously the same, technology, the same frequency, is how you've been able to use that for such a variety of things. Where else do you potentially see where it could go? Is there other areas where it can be used?
Well, I think that one really interesting part of what we're experiencing now is understanding that you cannot separate physical pain and fear. And where it's interesting because we're discussing this right now with the FDA, because a lot of the studies with Buzzy have come up with the realization that not only are we decreasing pain, but we're also statistically significantly decreasing fear. And so whether that's why Buzzy is working or how much that plays into it, there was a study with people who had very little mental capacity, like they'd all had brain injury, and Buzzy worked better for them than it has in a lot of other studies, which implies that it really is a nerve thing. But we are clearly finding that you can't, FDA is saying, well, this is a physical device, so you're looking at a physical pain relief. And what I'm saying is, actually, our understanding of pain is wrong. What we're taught in school is that pain is a nerve issue, and it's not. It's a brain issue. Pain is happening in the brain, and so it means that it's not just that you process it in the brain. It means that the brain's interaction with pain is a big part of what you feel. So some of what you can do to decrease pain is to give patients control over it, but some of it is also repetitively destimulating the area so the brain's actual perception gets smaller. So it's so fear is a legitimate and specific part of the pain experience. And I think that the people at the FDA are saying, well, no, we're a physical devices group. And we're saying, yeah, so are we. This is a physical device. It just happens that it is profoundly effective for a part of pain that we think is psychological, but the reality is all pain is happening in the brain.
And so that would be sort of that you do create changes. Would it even be structural changes in the brain that occur over time, or is it just chemical firing?
No, well, just like if you start pumping iron, you're going to get structural changes.
Yeah.
Any physical change, any chemical change in your body over time is going to become structural eventually. What's really interesting is the place in the brain that it changes is the thalamus. And so the thalamus is kind of the motherboard for the brain. Everything is going into and being routed around where the thalamus is. It goes in the thalamus first, and then it gets fed off. In patients who had knee pain because they needed a knee replacement surgery, they had enlarged thalami at the time of the surgery because they'd been in pain so long, their thalamus gets big. And 6 months after the surgery, thalamus goes back to normal. So all of these bits, the fear, the aspects of pain that involve volition, and even how much the pain bothers you. That's where acceptance and commitment therapy comes in. That's where distraction comes in. Is if the pain's not going to bother you, then you have a better outcome. It's not just the nerves; it's all happening. So that's one of the reasons why the fact that even somebody with limited mobility can put an ice pack inside a VibraCool. Somebody can put it on and it's one touch and it works, is because part of pain is control and fear. And if you know you can do something to make the pain better, it doesn't hurt as much.
And would that make the individual more sensitive to other spots in their body as well? If you have an enlarged thalamus, it wouldn't just be the connection between two spots. Would it be?
No, that's such a great question. It doesn't seem to be. It really does seem to be site specific. I think that one of the coolest analogies is the alarm system. So if you are worried about someone breaking into your house, you're going to put alarms around that place. And if you keep having pain, if you keep getting broken into, you're going to add more and more alarms. And so over time, even if it's just a light touch in that area, if it's wind blowing past the window, it can set off the alarms. What it doesn't do is generally necessarily raise your awareness of pain everywhere. Now, if you've got chronic pain multiple places, yeah, that's gonna, fibromyalgia or something, that's gonna jack it up. But it really seems, this is called hyperalgesia, it's called ramp up, and it really seems like that is very location specific. So in the brain, you've actually got nerves that are mapped out for different areas that correspond to, they call it the homunculus. It's like an upside down person, but your lip sensation is here, your foot sensation is here, and all these representations are actually mapped out. So the thalamus probably has a motherboard that's similarly mapped out on a small scale, but it really is a very location specific pain ramp up, and that particular pain ramp up area is going to go down after the cause of the pain is gone.
And that's always interesting, because there's some individuals, you see it goes normal, and then other ones it just doesn't go away. And I've always been just kind of curious, why they maintain that sensitivity and the fear part. If you're still scared 24/7, it's going to hurt. You potentially could be driving the same mechanism over and over and over. Just to your point, I'm going in there to try to take the alarms out, and you just keep putting them back.
Yeah. And another analogy is if you're an expert in music, you're going to hear things in a symphony that I am not going to hear.
Yes.
Because you've been paying so much attention to it. You're very sophisticated and nuanced in your appreciation of it. Anybody with chronic pain is very experienced and nuanced in their appreciation of it. So
you see with top athletes as well.
Right. And so they're going to feel more. They're going to have a much higher level of sensitivity to it than somebody who is not usually having pain someplace and decide to ignore it.
I used to have much more chronic back pain, was far more sensitive, and I took care of myself and don't have it anymore. So when I get old back pain, it's not as nowhere near what it used to be. It used to be like debilitating. But mechanically, there's probably no major difference. It's just, you just finally address the issue.
Right, and you got your brain to stand down and to quit being freaked out about it. Yeah, it's unquestionably something that lends to the chronic pain cycle, because people feel like I am going to have this pain for the rest of my life, and then they start doing what they call catastrophizing. So then they're like, all right, I'm done. You know, I'm not going to play golf. I'm not going to garden. I'm not going to have this. Yeah. And so, so how long did it take after you started taking care of yourself before your pain was better?
Full year.
Full year. And I think that this is one of the things that's kind of interesting about like nausea after pregnancy and pain after you start getting rid of it, is that all of a sudden you realize it's been X number of days since I have experienced pain. Mm-hmm. Right? I mean, it's like, oh, it doesn't go away all at once. It's like all of a sudden you have to go, oh, you know what? It's been a minute. I have not seen this.
Mm-hmm. Took about a year. And that's it takes. I had to go listen to my own advice, do the same core things, exercises, avoid these types of things, eat less inflammatory food. I mean, everything. But then once the system reset, I haven't had the severe issues. You know, I get a back spasm here and there, but before we're talking about unable to work.
Wow. Now, what kind of foods did you eliminate, and which foods are you still not eating?
So the ones that still not a lot of dairy, so like milk and peanut butter. A lot of hydrogenated oils tended to flare it up. Biggest one was stress. So being able, because stress and back pain are like two peas in a pod. I'll let you know that right now. And being able to catch it before it started ramping up. Don't catastrophize it so it gets back down, and then you just you manage it, and then you learn to do over time. Is how one of the reasons why I love the VibraCool is because if I start to feel it, I go get a back brace, slam it on, stick this thing in there. Within 10 minutes, what started to raise just dropped right back down to steady state. And now, more importantly, I have control over it, and I shut it down. Right. Now, if I shut it down, that means I can do it again. Yeah.
Yeah, and that's why, you know, the whole pain, fear, focus continuum, when I broke my neck and hurt my shoulder, you know, the shoulder pain afterwards, before we'd invented the VibraCool Flex, I was having a lot of interruption in my day because of the pain. Once I knew the Flex was in the other room, even if I didn't have it yet, you know, even if I was like, all right, you know what, I can tolerate this for longer. So it's also that just knowing knowing you have the option, you don't even have to use the option, just knowing that, all right, you know, if I want to get off my butt and go in the other room, I can pick it up and do that. Yeah.
Tell patients that, like, you know, the cane's there if you need it, but you don't need it. So it'll make you feel better, but you have enough strength and you're able to walk and everything else. It's so long as it's in the, I always tell them, don't throw it out, just leave it there. Because there'll be we won't reach for it. It'll just collect dust.
How very Sherlock. Yeah, that's a cool thing, and it's also it's a good point that knowing that you still got the cane in the back is something that can be added. Now, it's interesting that you have gotten rid of certain foods. Have you added any supplements or anything like that?
Fish oil.
Fish oil.
Main one added, and just a standard multivitamin.
But not magnesium.
I did not. It was when we talked about, but by the time I was perfectly fine at that point. Yep. Yeah. But it's something I've recommended to individuals on a regular basis because if they're had I known about it probably years beforehand, I bet you it would have been exceptionally effective. But I came to it later as I dealt with it and just discovering a lot of it was stress driven. And there is no food supplement for that one is just chill out, dude. It's a chill pill. If we
right. Yeah, my chill supplement for that one, unfortunately, has been weird, but now that we're not going to all sorts of different places anymore, the variety is down.
It's down.
Yeah, sadly. The brace that you use, are there different braces you use with the VibraCool for your back pain, or is there one particular one that seems to work the best?
Yeah, so I'll show you one that I like the most. Hold on.
I would like to see that.
So this is just one of the back braces that you can get these anywhere. Okay. And this one's called the Back Buddy. There you go. There's the Back Buddy.
Oh yeah, that is.
And it's one that will go around, and then it has the little straps to tighten it up. Okay. So you put it on, put the VibraCool in, and then tighten it.
So do you put the VibraCool right next to your skin?
I'll put it right on the spot that hurts. So
okay.
if it's the I know the spasm's right there. I just take it, goes right on top of it, and then it will sit in the unit like that. And if the next day it's hurting over here, I'll slide it over here. Starting over here, I'll put it over here.
Mm-hmm.
And it gives me control. So yeah. I have control over this. And usually I get it right in the first shot. Occasionally I have to go for a second spot because, I say I just moved. I lift a lot of boxes. Well, that guy got back in there.
Yeah.
But yeah, that's just so you in place and then compresses in. And beforehand, you just hit the button. And then after, when you got, I feel better, and I'll move around with it first, and then I'll take the unit out, leave the back brace on, keep going about my day, and then remove the back brace. So then I step down the compression and activity. So first I ramp it up, get it moving, then move a bit. Then I take the straps down so it's not so tight, move about, good, and then brace off. So that way I have a system of back to baseline.
So you said about 10 minutes for the VibraCool is usually how long it takes to stop the spasm. And then how long will you usually leave the brace on?
I'll leave the brace on for maybe another hour if it's still, but if I don't feel I'll go based on symptom. If I don't feel that tightness anymore, I'll take it off.
Yeah.
But if I'm going to go lift a lot of stuff heavy, then I'll leave it on because I'll know it's already in a position to have a problem. So if you're lifting like a lot of boxes, even moving homes, I had the back brace on before I started because I'm like, this is much more than I usually do.
Yeah.
I already know I'm going to be set up for failure. So get ahead of it.
I was going to say, you just moved houses. So you're probably in a big situation where you've got lots of moving. So you just wore the brace the whole time.
Yep. And as soon as I was done, though, this is the key mistake a lot of people make, take the brace off.
Oh, interesting.
Because I've been locked into place to deal with heavy stuff, but I no longer have heavy stuff. I don't want to keep that same level of compression and tightness. I've got to loosen it up so it moves again. So,
do you find any particular time of the day that your spasms are more likely to start? Like, is it more common that you'll wake up with them? Is it more an end of the day?
No, it's mechanical, lifting too much, picking up a kid, it's very mechanically driven. So.
Yeah.
But if there's more stress and something else is going on, that can make it worse. So that's the amplifier. That's that fear part, that stress. The system's already driving faster, and you're more sensitive everywhere. Then that's part of it as well.
Yeah. Well,
first.
So which is kind of explains why we've got so many issues with pain right now, because people have stress. People don't have to deal with it. They're locked in and stuck. And I think that's one of the rationales why something like VibraCool that's easy to use and you can put it exactly where you need it is the solution for this particular moment in history.
Oh yeah, because you're at home. You don't have any control. I mean, a little bit of control goes a long way. So
yeah, I think that's actually a really interesting thing for us to point out is maybe on I'm making notes as we do this, but one of the things would be for Amazon, frequently purchased with to say with Amazon that people with braces getting the VibraCool as a companion product, because putting the two of them together really is so much synergy, more than just
so much
than just what's there.
So much.
Yeah, go on Amazon and leave a review talking about putting it together, because that would make sense. Or we'll get somebody who doesn't work for me to do that. But,
yeah, that's true.
But I do think that kind of concept is good. I wonder, so we talked about what you're missing with trade shows, and in a virtual trade show, so you can zip in. What do you think makes a virtual trade show less valuable than a face-to-face one, and what would be more valuable?
Yeah, it's a lot of it's just those interactions where you can see an individual, how they respond to certain things you say and do. Text, you just lose it. You lose a lot of those emotional cues, so that you get off of people. And then obviously it's physical products, so you got to putting it on someone so they can feel. It's like, oh, I can actually feel that vibration. So I can feel that cold. This has a bit more
product. The physical therapy show, you used a product, it's somebody else's booth. So that's something else that we miss in because is industrial espionage. What was that product that you tried out with VibraCool?
I tried it with a compression product for the knee, like a cold compression. And the whole idea behind it was put in there and then see if you use it in conjunction together with the cold compression and the vibration. So when you get into a live arena, you can also feed off not only the knowledge, the energy, the creativity, all that type of stuff that's going on in the room. And it stimulates the little neurons in your brain to be more active and saying, well, this is how they're presenting it. Well, how could I present it in a way that would attract the same audience? And I think that sort of shared knowledge and energy is why people have liked those types of events. It's because otherwise you can just go click on a computer. We are very humans. We are actually interested in human contact. We are, and it's challenging to do it from a distance.
One thing so we're currently on an IAB virtual healthcare conference, trade show. And I think that one thing that is a problem for us with our devices is that, when we're at a live trade show, we say, well, we use, mechanical oscillation and ice, and people are like, what's mechanical oscillation? And we say it's vibration, and they're like, oh, I've felt that before. I know what that feels like. And so because it feels really different in reality than the words are, I think that's one thing that makes a virtual trade show less good for us, because people think they understand what's going on, but it's not. That's the whole point, is that the frequency matters. So
yes, because otherwise it could be anything else that's just shaking and oscillating, and hitting the right frequency, and the right science behind it is how your body responds. We are all wired relatively similar, and but we also are wired to say, well, I already know that. That's sort of
that's really interesting. Yeah, I think that we assume over the course of being alive that we know, everything. I don't know. Is that fair? I mean, at least we've got a working hypothesis that gets us through most things. So it is easier to understand an improvement on something than it is to understand a brand new idea.
I agree.
But, that gets to your idea about bracing. So improving the brace with the mechanical stimulation may be easier to understand than just put mechanical stimulation on it.
Because you already understand the brace, they're just adding a component to it. And as opposed to, you're not completely reinventing a wheel here, you are adding what you didn't know was missing. Like there's another part to it. The brace in itself does not fix pain. And, it does not. It puts you in a position to be less irritated. It's not going to stimulate anything. And it's not going.
That's true. It's going to stop ongoing damage, but it's not going to do anything to repair it.
There's a stop gap. It says, whoop, we're going to stop the problem. Cool.
Yeah.
Okay. And that's a very important part of it. It absolutely is. I'm not poo-pooing any brace in the world. I think they're very, very valuable for what they are. It just takes that next step. Okay, now that you've locked it down, what are you going to do? And that's sort of the kind of the crux of the whole thing, is like, what can you do to be able to take it to that next, where it's like, okay, I've held it in place, now we're going to get you better. And
I think there's got to be some kind of some kind of catchy thing, whereas braces to stop ongoing, and M-stim is to reverse it, to treat it. There's definitely something. There's something there.
There is.
So yeah. The interesting thing about a virtual trade show is also that you really can sort of skim rather than committing to learning more. And I wonder how that is going to impact the learning that our kids are going to be doing online because of coronavirus. If that's going to change.
Absolutely. I'm always challenged just to get my kids to be able to stay focused, and it's because there's tons of distractions. And the nice part is when you're in front of somebody, it's hard to. There are less distractions.
When do they start again?
Hopefully 3 weeks. So
fingers crossed. What are you hearing? So I know that there was a big movement in the bracing world recently, and that CMS is like, yeah, we're only going to do a certain number of things. What are you hearing in that arena at this point?
So I think what I'm hearing is they're, for off-the-shelf braces, that they are fighting for certain markets, so that the Medicare and CMS wants to cut down on the number of groups they have to monitor. And so what it's causing all the bracing companies to do is put their best foot and best bills forward to determine if they're going to be able to get a slot. And so this is a way of removing some of the administrative ends in the system. So if there's less to monitor, by definition, it would be less to cost to do that. So there's a lot of shakeup right now, but it started at the beginning of the year, then COVID hit, and so it's like piled on top of each other now. So what you hope in the end, though, is that the better braces and the better quality service and everything will rise to the top, because they will have the products that have a stronger presence and are more effective. And so crossing fingers, that's what hope for the patient population, is that when they get these things, they are just as quality as they actually say they are, because they're going to have to fight to earn everyone's business.
Now, if you're a betting man, I mean, DJO is clearly one of the major players in the field. Who else do you think would be likely to emerge victorious? There are going to be only one or five.
Yeah. So I'd say, Delco Innovations has great products. So they make really good things. Your ones for obviously your Don Joy ones, your some of your larger providers for the rehab space are going to have their own OTC brands in there as well. I honestly think it's particularly because they're being billed. I think that's the biggest issue, is that you have to prove that this thing is worth billing, as opposed to just something that you just say you stuck on Amazon.
Yeah. And
just to use. And I think that's where the cream is going to rise to the top. And just hope in the end that it works. That's what actually helps provide more control and better care for patients without getting getting ripped off to pay a ton for something that doesn't need to be cost a ton.
I'm just pointing out we are on Amazon, so on Amazon, watch yourself, my friend.
That is true, but these are individuals. We don't have something that we're then billing to insurance and charging them $1,000.
Well, that's and which is of course ridiculous. I mean, that's.
And that, I think that's the part that that ridiculous part. It's like, you can't, like, if it did cost the same here, it should cost the same there.
Yeah.
And that's fine. But why does it cost X here and then cost 10 times as much? I think that's the head scratcher to me.
Yeah. Well, I will say that one of the things that I've learned about having a medical device company that is regulated by the FDA is that so many of our friends can say anything they want. So many of our colleagues who've got consumer products, something that lights up a toilet in rainbow colors. You can say anything you want to about that. You also don't have to pay $5,000 a year for the manufacturing certification and for the patent certification and every place else that's part of the cost of doing business in a regulated industry. And so getting some of the benefit back and having a higher price does kind of make sense when there's so many additional barriers to jump over. That's what we were trying to do that was really different, is let's make a product that has all the same rigor, but make it affordable. And it's still an experiment that I'm not sure how that's gonna play out.
It's one of those things till you hop in, you find out. But it is not fair that individuals, they put in a lot of time and effort and the research and everything just to meet all the standard hoops. And to your point, you make something that is just a pivot to the left of it a little bit, and then you apparently escape all of the regulations. And that's a little
right, exactly.
That's not fair.
Yeah. One thing I heard from somebody yesterday, so they had gotten the same kind of Health Canada stuff that we did, but they were doing a product that was that Health Canada really wanted, and they weren't going to make a profit on it because they were doing it for a pro bono type thing. And Health Canada said, okay, well, you need to have all these regulations, and they're like, oh, then we're not interested. And so Health Canada said, oh, never mind the regulations, you're fine. That kind of thing is I think the part about where we've gotten to with regulatory that's frustrating, because there's definitely layers that are just the way they've always been done, but aren't really necessary to protect the public.
I agree.
So if we were going to put VibraCool on Amazon with two different braces, are there two different braces that you would recommend for knee and back? So your brace buddy, is that the guy?
Yeah, it's a back buddy.
Back buddy.
It's a back buddy. And then other ones that are out there, you got, I like this Mueller one, this knee brace. I'll pull it out here. Here's a nice Mueller knee brace for patellofemoral.
Oh, very nice. And does that stop the patella? Does that stop the end of the quadricep from scooching over?
There you go. It goes around there. You're able to pop it right in. Another one that I've liked is just honestly is a standard compression brace. So it's like the one that power lifters use that just puts pressure around their knee. That works the best with this because it slides and stays in place. It's interesting that the low cost, easy to put on, it adds the compression and it stays right in the spot.
Show me that one again.
What's that?
Show me the low cost one.
Yeah, that's what I'm trying to. I wonder if I stuck it upstairs because I was actually using it. Let me see here. Here's another Mueller one. And here's one that was, I'm trying to find it's yellow, and it wasn't in my bag of tricks when I moved over here, so I took pictures of it. So I think it's upstairs. But this is one that's like a full knee brace.
Oh yeah. Yeah.
So I put it in here, worked just fine. So.
How much is the little guy? How much is the little patellofemoral knee guy?
Oh, that's like $14, $15.
Dude.
Yeah. So, and the compression one's like 12, 13,
Mm-hmm.
and then something like, then you have these other ones like for recoup. They have a cold pack, right? There's a recoup, and this is one that you just use as a cold pack, and it has little clicky guys that tighten it up.
Oh, I like that guy.
Yep. Yeah, but this is more like $70 or $80.
Oh.
But again, slides right in, boop, and this thing goes in the freezer, and it adds again that compression part, and it's right in there. So this thing works with so many different things that you have it normal use, and then like if you just had one of these things in the house, which you probably do, you've now expanded the usage of your VibraCool tremendously. And
so I think, Keith, that it'd be useful for you to just do little quick videos and say, this is how you use VibraCool with an X brace. Here's this on. Here's how you use X. Here's how you use VibraCool with the back buddy, and then we can just put those specific ones up because I think that everybody's a little bit anxious about trying something different, and they're anxious about doing it wrong, and so to be able to put, this is how you use VibraCool with each of those that you have.
Let's go talk to Medline. They have all these.
Yeah, well, I think put them
Talk
on.
to Jamie.
I think
Hey, Jamie, you send me stuff.
put them on StreamYard on live, right? You know, we could do that. We could do that this afternoon, but I think that those would be some really great things to do. Well, it seems like at this point, I've talked to you know, our team, and we don't actually have any other people that are scrolling through what do you call it, the virtual booths right now.
Okay.
So I think that we can stop our live stream, but right now I'm going to get Jennifer, I'm going to get Sarah, and let's actually go ahead and make those live videos right now with our StreamYard, and let's put them up on YouTube.
Yeah, we could probably do it for, let me see here. I'd probably say the one due right now would be for, let's just, because I can do the StreamYard. I'll do the back one first.
All
I like
right.
to see how it comes out with lighting.
I'm going to stop the cam, and I'll touch base with you.
Okay.
All right. Thank you so much for being on.
Absolutely.